Please note that ZFF adheres strictly to its data privacy policy to ensure the confidentiality and protection of your personal information. This webinar series is both a celebration and a learning opportunity. We gather to acknowledge the efforts of local governments in advancing family planning and adolescent and youth sexual and reproductive health, and to reflect on the systems and leadership that have made this progress possible. On your screen is a TCI logo. As you can see in its concept design, the angular interconnected forms evoke a sense of collaboration and partnership, symbolizing how our TCI cities are united in a dynamic network of shared knowledge and resources. The deliberate use of white space represents a possibility, signifying room for growth, innovation, and the ongoing expansion of the initiative. With its modern geometric aesthetic, the design reflects the forward-thinking and progressive spirit of TCI and underscores the transformative change taking place within disconnected urban communities across the Philippines. This webinar series will bring together local government leaders, healthcare professionals, youth advocates, and international partners. Our objectives at the end of this learning forum are, first, to recognize effective leadership, advocacy, and community engagement strategies to strengthen health programs and services. Second, to understand the importance of grassroots involvement in FP and AYSRH awareness and service delivery. And third, to enhance adolescent-friendly services through inclusive program design, coordinated referrals, and multi-sectoral partnerships. We would like to acknowledge our esteemed guests, partners, and participants for our first day of the Learning Forum. To our attendees from Iligan, Naga, and Santiago. We also have participants from other TCI cities, those that have already graduated, and those that will be graduating very soon. Welcome to our webinar. Before we dive into today's session, we would like to share this video overview of what the Challenge Initiative, or TCI, is, especially those who may be hearing about it for the first time.
Did you know a single investment has the power to tackle a multitude of global challenges? Urban poverty, maternal and child deaths, climate change, gender equity, and human rights. This investment is family planning. Evidence shows that for every dollar invested in family planning, society reaps $120 in benefits. Where can we invest to have the greatest impact? In the rapidly growing urban slums of Asia and Africa. 70% of the world is expected to live in cities by 2050. 90% of this growth will be in Asian and African urban areas. And most of that growth will be in poor urban slums. Providing family planning to women and girls living in these slums can ensure a brighter future for all global citizens. When a woman or girl can decide whether and when to have a child, she is empowered to pursue an education, a job opportunity, or start or grow a family. This leads to many benefits: better health for children, women, and families, increased attendance and better performance in school, improved economic conditions for communities, lower healthcare costs, less stress on urban infrastructure. The Challenge Initiative offers a groundbreaking opportunity to have a dramatic impact on underserved urban poor communities. The initiative is business unusual, considering financing, scale-up, and sustainability in providing urban family planning solutions that work. It is a strategic shift away from the traditional aid model because local city governments decide if they want to participate, committing their own human and financial resources, political will, and ideas for solving family planning challenges. In return, cities get access to technical expertise and high-impact, evidence-based solutions to adapt for their local context. The initiative also provides funding through its Challenge Fund, which is open to other donor contributions. ensuring even greater returns when cities implement their own family planning programs. In addition to helping solve one of the most pressing issues of the 21st century, contributing to the Challenge Initiative provides major leverage for both cities and donors. Invest in innovative, high-impact family planning programs with trusted partners and proven solutions. Join our challenge.
As you have seen, TCI was launched in 2020, and the Philippines became part of a global platform that aims to make a lasting impact on family planning and adolescent health. It is co-funded and co-managed by the Zwillig Family Foundation, the William H. Gates Senior Institute for Population and Reproductive Health, and Bayer International, with technical support from the Johns Hopkins Bloomberg School of Public Health. In just over a year and a half of implementation in the Philippines, the cities of Manila, Las Piñas, Iligan, Iloilo, Santiago, Naga, Binyan, and Mandaue have already shown remarkable leadership and success in scaling up select high-impact practices, resulting in improved health outcomes for their communities. We are excited to share more about TCI throughout today's session, and hope you'll be inspired by the work being done across the country. Before we proceed to our featured city presentations, it is my honor to introduce our speaker for the opening remarks. She is the Senior Program Officer for the Challenge Initiative and primary liaison to the TCI hubs of India and the Philippines. Prior to TCI, Kate Graham managed projects in maternal and child health in Pakistan and supported projects across Afghanistan, Bangladesh, and Myanmar. She brings extensive experience in donor contribution, project management, and reproductive health programming. Earlier in her career, she served as a Peace Corps volunteer in Zambia, leading community-based reproductive health and family planning initiatives. Please join me in welcoming Ms. Kate Graham.
Good morning, everyone. My name is Kate Graham, and I serve as the Senior Program Officer for the Challenge Initiative at Johns Hopkins University, based in Baltimore. For those of you who have had the pleasure of meeting before, it's wonderful to see you again. And to those I haven't met yet, I look forward to connecting with you the next time I'm in the Philippines. Salamat po sa pagtanggap sa aking dito. It's an honor to be here with you at this milestone event, a celebration of your dedication, leadership, and the meaningful progress you've achieved. Today is not just the conclusion of your time with TCI. It marks the beginning of a new chapter where your cities are boldly leading the way in building stronger, more responsive systems for family planning and adolescent sexual reproductive health. Over the course of this journey, we've seen something remarkable unfold: the emergence of local champions like yourselves, who are not only implementing high-impact practices, but doing so with vision, heart, and bold determination. This webinar series celebrates the innovation and commitment of our local government partners in the Philippines. It also recognizes the hard work of every barangay health worker, youth advocate, city official, and civil society partner who stood behind this mission. Together, you've charted a path towards self-reliance, towards systems that endure, and towards a future where women and girls and young people can thrive. So let's take a moment to reflect on what we've accomplished over these past few years together. In Iligan City, they took bold, proactive steps that accelerated family planning and AYSRH programs, empowering women and girls to make informed decisions about their future. In Naga City, they implemented comprehensive strategies to prevent teen pregnancy through policy, community engagement, and above all, youth leadership. In Santiago City, they fostered shared governance in peer education, placing spotlight on education and economic opportunity as key tools for protecting adolescent girls. Binyan City transformed its outreach by listening deeply to women's lived experiences and designing services that reflect the complexity of their roles and needs. In Mandaue, the City Women's Health Caravan made services accessible and equitable, bringing care to the people rather than making them come to it. And in Manila City, they tapped into the spirit of Bayanihan, delivering services directly to underserved areas and reclaiming reproductive health as a community right. Iloilo City created safe, adolescent-friendly environments rooted in local context, approaches that are gender-sensitive and culturally grounded. And Las Piñas built a truly multi-sectoral response, linking education, health, and social services to provide a holistic care to adolescents facing reproductive health challenges. Each of these cities, each of you've proven what's possible when local leaders take ownership, when they lead with courage, compassion, and clarity. Your collective work is contributing to a national movement, a shift towards sustainable, adolescent responsive systems that prioritize dignity, access, and agency. Systems that ensure every young person has the information, support, and care they need to make empowered decisions and choices. But let's remember, this work isn't just about technical practices or policies. It's about building environments where all youth and women, regardless of gender, can thrive, and where women and girls have equal voice, choice, and power over their bodies and their lives. So today I invite you to be present, to be proud, but also be bold. Let's learn from each other, challenge assumptions, share your experiences, and think about how the models shared here can strengthen your own strategies and your own unique city contexts. Because what we do together now will shape a healthier, more just, and more empowered future for the generations to come. So congratulations to all our graduating cities. We're so proud to stand with you in this moment and even more excited for what's to come next. So thank you so much for having me, and congratulations, everyone. I really look forward to what's coming next in all of your cities.
Thank you very much, Kate, for your inspiring opening remarks. Your message underscores the importance of local leadership and ownership in building sustainable, responsive health systems, a theme that will guide our discussions over the next 3 days. We deeply appreciate your continued support and commitment to the Challenge Initiative and to our partner cities here in the Philippines. Now, today's sub-theme is Cities at the Forefront. We are pleased to feature the cities of Iligan, Naga, and Santiago, 3 local government units that have led the way in implementing and scaling up high-impact practices for FP and AYSRH. After each city's presentation, our partners and stakeholders will share their responses, followed by a brief open forum for questions and answers. If you have any question you wish to address to one of our speakers, please type them on the button below, labeled Q&A. We'll then move on to one of the most exciting parts of the program, the graduation of our TCI cities, and their acknowledgement as globally self-reliant cities on urban reproductive health. To wrap up, we will have a synthesis and formally close day 1 of our series.
We begin with Iligan City, a local government that has embraced active leadership to accelerate family planning and adolescent health outcomes. Under the leadership of Mayor Freddie Xiao, the city has implemented high-impact practices and fostered strong local partnerships to fast-track results. Mayor Frederick or Freddie Xiao is a leader deeply connected to the city he proudly calls home. With over 2 decades of public service experience as city sports director, city councilor, and lone district representative since 2016, Mayor Xiao brings both vision and results to local governance. He has authored and co-authored over 350 bills, carrying his governance style that is rooted in community consultation, believing that real progress is built through listening and collective action. A visionary, a public servant, and a true Iliganon, Mayor Freddy Xiao continues to build a healthier, stronger, and brighter future for all. Let us now listen as he shares the story of Iligan.
Good morning, everyone. It's truly an honor to be here with you today as we talk about an issue that is close to my heart: the well-being of our youth and families. Active leadership in fast-tracking family planning and adolescents and youth sexual and reproductive health, or AYSRH. Outcomes is not just a program, it's about creating a future where every young person, women, and men in Iligan has access to the care, guidance, and opportunities they deserve. Leading with purpose for Iligan. I was born and raised in Iligan. This is where my dreams were formed, and I learned that true leadership is about service, not status. My public service is deeply personal. My leadership journey is rooted in compassion for people and a strong belief in inclusive development. Before becoming mayor, I served in the House of Representatives, advocating for legislation focused on education, youth empowerment, and local economic development. However, returning to serve as the mayor of Iligan provided me with a direct platform to create meaningful change at home. My leadership is characterized by the ability to connect with people at all levels. Listening is the most powerful tool of a leader and embodies this philosophy by engaging with communities, listening to residents, and collaborating with barangay officials to co-create solutions. The cornerstone of my leadership philosophy is inclusive governance. In my administration, Iligan has introduced programs that actively involve women, youth, indigenous communities, and vulnerable sectors, not merely as recipients, but as partners in progress. Leadership is not only visionary, but also results-oriented. Together with other leaders in Iligan, we secure budget allocations for long-term programs, integrates data systems, and collaborate with national and global stakeholders to ensure that plans are translated into action and policy. In 2022, Northern Mindanao recorded a notable highest percentage of women aged 15 to 19 years who had never been pregnant based on NDHS. This alarming trend has raised serious concerns for the city. Amid disruptions in maternal and reproductive health services, Iligan has experienced a concerning trend in adolescent reproductive health outcomes. The adolescent birth rate, or ABR, dropped from 46 in 2020 to 29 in 2021, surpassing the target. However, in 2022, the ABR rose again to 42, once more exceeding the target. This fluctuation underscores the pandemic's impact on young people's access to reproductive health education, services, and support. The other graph illustrates the modern contraceptive prevalence rate, or MCPR, among women aged 15 to 49 years in Iligan City from 2020 to 2022. Compared to the target of 30%, the MPCR has increased by 1 percentage point per year, indicating steady progress. We aim to accelerate our efforts to implement effective strategies that will sustain and enhance these aids. In 2023, I initiated the Iligan City's entry into the Challenge Initiative, or TCI, a global program co-managed by the Swillig Family Foundation and the William H. Gates Senior Institute in partnership with the Department of Health, Center for Health Development, Northern Mindanao, and the Commission on Population and Development. TCI empowers local governance. TCI empowers local governments to accelerate and sustain effective family planning and adolescent sexual and reproductive health, or ASRH, solutions through strong local ownership. To champion inclusive and participatory governance, we adopted a collaborative leadership model that actively involves stakeholders from grassroots communities and the private sector in designing, implementing, and evaluating health development programs. Through Executive Order Number 28, Series 2023, we formalized the City Leadership Team, or CLT, a multi-sectoral coalition committed to ensure that Iligan's health services are adolescents-friendly and responsive. The CLT leads initiatives focused on workforce development, facility enhancement, and capacity building to drive sustainable health improvements across the city. We partnered with academic institutions like Adventist Medical College to better understand the challenges health workers face in reducing teenage pregnancy and Iligan City. Researchers conducted a study in 4 barangays, Tambacan, Tipanoy, Santiago, and Abono, and generated valuable evidence that strengthens our adolescents' reproductive health programs. Their findings offer actionable insights that allow us to design smarter, more efficient, and sustainable approaches tailored to the realities on the ground. This research initiative supports the Challenge Initiative's TCI High Impact Interventions, or HIIS, ensuring that our strategies remain evidence-based and context-responsive. Through this partnership, we continue to accelerate efforts to reduce teenage pregnancy and improve youth health outcomes in Iligan. Dr. Glenn Managpaak, City Health Officer, emphasized the impact of TCI. The collaboration and ownership of the problem and its solution is a key contribution of the TCI program among us from the City Health Office, LGU, and other key agencies. He noted how it shifted the city's approach from fragmented efforts to a unified strategic framework. Before TCI's engagement, interventions in Iligan were often fragmented, characterized by limited data disaggregation and minimal youth engagement. ASRH and FP were largely seen as a responsibility of the health sector. With TCI's coaching and technical support, however, planning and implementation have become more evidence-based, participatory, and inclusive. Youth, women, and community leaders are now actively involved, and the principles of gender and development has been mainstream across FP and ASRH programs. I have made it a priority to strengthen our family planning and adolescent health services. We have increased budget allocations to support logistics, capacity building, facility improvements, and demand generation activities because we believe every individual deserves access to quality reproductive health care. Together with TCI and CFF, CPD, RO10, DOH, CHD, and M, and our city leadership team co-developed the 2023 to 2025 program design to guide our efforts. This comprehensive program now drives the implementation of high-impact interventions and evidence-based strategies. Through it, we aim to reduce teenage pregnancies, enhance our service delivery system, and expand access to modern family planning methods to every community in Iligan City. I take pride in how our city leadership team continues to strengthen our health systems through meaningful data-driven action. We reoriented the training to improve nurses and midwife skills in recording and reporting family planning data. Participants received updates on the 2018 FHSIS version, practice using standardized forms, and completed simulation exercises to generate the FPM1 report. We also provided hands-on training in data quality check, or DQC, processes and introduced changes to FPM1 reporting per DOH Memo 2023-0071, and this effort reflects our broader commitment to competency-based family planning services. By investing in continuous coaching, mentoring, and system improvements, we are building a strong foundation of accurate and reliable data. This empowers us to deliver high-quality, right-based reproductive health services that truly meet the evolving needs of our people. I am committed to championing youth inclusion in health and governance. We are expanding our services and implementing policy reforms prioritizing young people's well-being. We have strengthened our data systems and streamlined our referral network to deliver integrated adolescence-focused services, including adolescent sexual and reproductive health, or ASRH, mental health support, substance use prevention, and child protection. As a result, we have established 19 Level 1 adolescence-friendly health facilities that offer youth-centered care, from psychosocial assessments and family planning council and to HPV immunization and maternal health services. In partnership with the Commission on Population and Development, the City Population Office, and the Department of Education, or DepEd, we developed and promoted the SHAPE module. This comprehensive sexuality education program equips learners with the knowledge and confidence to make informed choices, empowering a healthier generation. We engage our youth through peer education sessions, youth summits, and community-based dialogues that create safe spaces for open conversations about reproductive health. As one young citizen, Maria Santos, shared, "Having our voices heard in these discussions makes me feel empowered. We need services that understand our needs." In addition to further institutionalize youth participations, we took a significant step forward by enacting Resolution Number 25-210. ICYDO collaborates with local organizations and the local Youth Development Council to ensure that adolescents have direct access to accurate health information and essential services. By working closely with trusted sources, we ensure our young people receive information that is timely, relevant, and tailored to their unique needs. As Ms. Nora Fe Escorial, our local youth development officer, emphasized, by providing direct access to trusted sources, young people receive information tailored to their needs. Through this bold move, we affirm that youth voices matter, not just in discussions but about their well-being, but in decision-making spaces where policies are created. We prioritize sustainability in Iligan City's health strategy to ensure lasting progress. By increasing our health budget and institutionalizing positions for trained health personnel, we are building a resilient health system that meets our people's evolving needs. We are establishing 2 family planning standalone clinics to improve reproductive health services. These clinics will enhance access to modern family planning methods and provide financial protection for women and families, empowering them to make informed health choices. We continue to expand the CADA network, a platform for adolescents empowerment and youth-led advocacy. This network is essential in reducing adolescents' pregnancies, promoting life skills education, and ensuring young people can access necessary care and support. Latest data shows a promising decline in the adolescents' birth rate from 2023 to 2024, accompanied by an increase in modern contraceptive prevalence rate. These positive trends emerged following the launch of the Challenge Initiative in partnership with DOH, CHD-NM, and CPD RO10 in Iligan City. Clear evidence that our community-driven approach is effective. These results affirm that investing in people-centered, youth-friendly services and strengthening our local systems creates a real impact. However, adolescent pregnancy remains a challenge that requires our continued focus and collective action. With the unwavering commitment of the city leadership team and the support of our health workers, partners, and communities, we will sustain and scale these gates. Together, we are building a future that empowers families, especially our youth, ensuring that every young Iliganon can thrive, healthy, informed, and hopeful. Daghang salamat.
Thank you, Mayor Xiao, for sharing Iligan City's journey. Your presentation reminds us how strong local leadership can accelerate access to essential health services, even in challenging contexts. Next, we turn to Naga City, known for transforming bold visions into concrete action. Led by Mayor Nelson Legacion, the city has taken strategic steps toward reducing teen pregnancies through grassroots capacity building and barangay-level engagement. We are honored to welcome Attorney Nelson S. Legacion, outgoing Mayor of Naga City and now Congressman-elect for the 3rd District of Camarines Sur, as one of our distinguished speakers. A public servant with over 2 decades of experience, Mayor Son is widely recognized for his transformational leadership and commitment to good governance. Under his leadership, Naga City received the Seal of Good Local Governance in 2024. His people-centered approach has earned Naga the prestigious title of overall most competitive component city in the Philippines for 4 consecutive years from 2021 to 2024. Guided by the vision of a healthy city, Mayor Legacion's motto, Nalalauman, nasasarigan, nangangataman, or reliable, dependable, caring, reflects his deep commitment to public service. He prioritized access to education, established initiatives supporting grassroots justice and family welfare. He began his career as Naga City's legal officer. From a humble background, he rose through the ranks through grit, academic excellence, and unwavering service to the community. Today, he brings with him a wealth of experience and insight that continues to shape not only Naga City but the entire 3rd District of Camarines Sur. Let us all give a warm welcome to Mayor Nelson S. Legacion.
Diyos marahaynal daw po sa gabos. Greetings from the city of Naga. Naga City, known as the heart of Bicol, is renowned for its rich history, deep religious heritage, and a strong sense of community. With a population of over 209,000 as of the 2020 census of the Philippine Statistics Authority, it stands as the second most populous city in the Bicol region. However, like many growing cities in the Philippines, it grapples with significant social challenges, including the rising concern of adolescent pregnancy, which continue to impact the youth and local development efforts. Naga City's adolescent birth rate showed an escalating trend over the past 3 years. In 2020, the ABR stood at 21 per 1,000 births, but it increased to 106 in 2021 and remained high in 2022 at 110. This includes both Naga City residents and transients. The data shows a troubling trend of repeated pregnancies among adolescents, with numbers steadily rising over the past 3 years. In 2020, there were 39 cases, which increased to 56 in 2021 and reached a high of 62 in 2022. Addressing adolescent pregnancy needed bolder efforts, as it was already compounded with limited access to reproductive health services, lack of adolescent-friendly facilities, and socio-cultural stigmas. The COVID-19 pandemic further strained healthcare systems, limiting outreach and education efforts while increasing vulnerabilities among adolescents. With that, Naga City partnered with the Challenge Initiative Philippines in 2021, a global platform co-managed by the Swillig Family Foundation and the Bill and Melinda Gates Institute for Population and Reproductive Health. Through this collaboration, the city established the City Leadership Team with the City Population and Nutrition Office as the TCI Lead Coordinator, which played a critical role in facilitating and implementing family planning and adolescent youth sexual and reproductive health initiatives. To directly respond to the challenges, we adopted high-impact interventions, which we implemented as partner of TCI. The decision to prioritize this critical issue stemmed from a careful analysis of key indicators. Data in Naga City's adolescent birth rate painted a clear picture of the challenge at hand. Furthermore, alarming rates of repeat pregnancy among adolescents highlighted the need for targeted interventions and sustained support. The barangay service point officers, who serve as key focal persons for family planning in the barangays, under the direct supervision of the City Population and Nutrition Office, meticulously conduct monthly profiling of all adolescent mothers and pregnant adolescents, maintaining an updated master list for better tracking and ensuring that young mothers and their children receive the necessary health support and interventions. We have also conducted trainings to other barangay health workers, making them more competent as adolescent youth health service providers. The City Population and Nutrition Office and the City Health Offices 1 and 2 have been accredited by the Department of Health as adolescent-friendly health facilities level 1, demonstrating a commitment to providing quality care tailored to the specific needs of young people. Establishing teen centers in communities. From the Naga City Teen Center established in 2016, the city now has 10 teen centers in the different barangays. These spaces provide a comfortable and confidential environment for young people to learn about sexual and reproductive health, access services, and connect with trained health service providers and peer facilitators. Creating teen hubs in schools. By integrating adolescent and youth sexual and reproductive health information within the school environment, students can easily access crucial resources and support from their peers and educators. Currently, there are 5 teen hubs already operational in different public high schools. Certifying barangay health stations as adolescent-friendly. The City Population and Nutrition Office and City Health Office are working to ensure that barangay health station offer a welcoming and non-judgmental environment for adolescents seeking health care, making them more likely to seek help when needed. Establishing the Adolescent Health and Development through Information and Service Delivery Network. This network streamlines access to vital information and services, ensuring that adolescents can easily navigate the healthcare and social services system and find the support they need. Naga City institutionalized its AYSRH initiatives through City Ordinance Number 2023-025, otherwise known as Institutionalizing the Adolescent and Youth Sexual and Reproductive Health Program to prevent and respond to teenage pregnancy and appropriating funds therefore. Also known as the AYSRH Ordinance, the groundbreaking policy, authored by one of the members of the CLT, Councilor Gail Abonal Gomez, aimed to curb teenage pregnancies and improve access to reproductive health services. The program places significant emphasis on strengthening social and behavior change communication, strategies to influence knowledge, attitudes, norms, beliefs, and behaviors to adopt healthier practices and social change. The Parent-Teen Talks, Hearts and Minds Seminars, Katropang Bagito, U for You, Usapang ASRH, Usapang Batang Ina, Batang Ama, are regularly conducted in the communities. Since joining TCI, Naga City has built a self-reliant and sustainable model for adolescent health programs, significantly increasing investments in AYSRH and FV services. The city's funding grew from 2.2 million pesos in 2023 to 5.1 million in 2024, supporting teen hubs, training programs, contraceptive distribution, and capacity building for health service providers. Through these collaborative efforts, by 2023, the city's adolescent birth rate significantly declined to 71, and by 2024, the ABR dropped further to 20, surpassing the national target of 37. The total number of adolescent repeat pregnancies has remarkably decreased, dropping from 38 in 2023 to only 20 in 2024. The city's MCPR trend shows an overall positive result despite the slight decline after 2022. This suggests that family planning and adolescent health programs have been effective in maintaining high contraceptive use above the national target. So what have we learned so far? 1. We cannot do it on our own. True, Naga City has been known as a center for good governance, but given the meager resources, establishing partnership with TCI has helped us significantly in providing capability-building activities for our health workers, government officials, and service providers. Number 2, the key to success is dependent on the participation of the youth sector. Given that AYSRH issues heavily impinge the youth, there is a need to engage them more fully in our programs and projects. Need for community engagement. The community itself will benefit from our initiatives. However, without their buy-in, our efforts would be for naught. Thus, as bridging leaders, we need to emphasize the concept of co-ownership. With all our efforts, success would not have been possible without the concerted efforts of our partners from national government agencies like the Department of Education, Department of Health, National Youth Commission, and Commission on Population and Development. We also extend our cordial thanks to the 27 barangay governments of Naga and the SK Federation. Last but not least, our heartfelt gratitude to the Challenge Initiative Program through the Swillig Family Foundation. As we look ahead, I urge each and everyone to carry the torch of advocacy for these high-impact approaches. Collaboration between and among educators, healthcare providers, policymakers, and community leaders is important in transforming our community from one that is responsive to one that is co-owned. With comprehensive sexual education, accessible healthcare services for the adolescent and the youth, community engagement, and a commitment to data-driven practices, we can dramatically reduce teen pregnancy rates and, in doing so, change lives for the better. Let us continue to work together for our youth, for their futures, and for a brighter tomorrow. Diyos mabalis.
Thank you, Mayor Legacion. Naga City's work shows us the value of investing in frontline health workers and barangay leaders to ensure sustainable, community-based interventions. Now, we hear from Santiago City, where both city and barangay leadership have actively invested in youth development. Under the guidance of Mayor Sheena Tan, Santiago has nurtured peer education initiatives that empower young people to become advocates for reproductive health. Mayor Tan's message will be delivered by Ms. Joanna Gabriel of the City Population Office and Santiago City Leadership Team. Joanna Sils Gabriel is a licensed teacher with a master's degree in guidance and counseling and units in psychology. She currently serves as a GOD focal person and head designate of the Gender and Development Resources and Coordination Office, as well as the Adolescent Health Development Focal Person under the City Population Development Office of Santiago. In 2018, She was recognized as the most outstanding city government employee and received the Gabi ng Parangal Award for her contributions in LGU projects. In 2019, she was named Most Outstanding City Population Officer and third place national awardee of the Rafael M. Salas Kaunlarang Pantao Award. She was a 2022 Bayer Scholar, completing 2 summer programs at the Johns Hopkins Bloomberg School of Public Health via the Challenge Initiative and Zwillig Family Foundation. In 2023, she became part of the first batch of the Regional Pool of God Resource Persons in Region 2 and was awarded Most Outstanding RPGRP during the 2024 Region 2 celebration of the Magna Carta of Women. A dedicated advocate for population and development, she continues to lead inclusive, gender-responsive programs aligned with global development goals. Let us all hear Mayor Sheena and Santiago's story. Ma'am Joanna, the virtual floor is yours.
A grateful day to everyone, partners and stakeholders in the promotion of adolescent youth, reproductive health, and family planning. On behalf of our City Mayor, Attorney Alisa Sheena Titan, CPA, with her undeniable commitment and passion, allow me to present our humble journey in accelerating scale-up high-impact approaches we underwent together with the Challenge Initiative. Provision on Population and Development, Department of Health, Department of Education, Department of Social Welfare and Development, National Youth Commission, the Challenge Initiative Global Institute and Philippines Hub, the Zwillig Family Foundation, our fellow graduate cities, and members of the city leadership team. We are delighted because we are sharing this significant name. Allow me to take you back to the starting point of our journey. Adolescent at the center, championing for adolescent reproductive health. In 2020, we ranked first among the cities in Region 2 for adolescent pregnancy, with an adolescent birth rate of 47%, 10 percentage points above the national target. This was deeply alarming. Ironically, our modern contraceptive prevalence rate was 39%, surpassing the national average of 30%. This disparity between contraceptive access and adolescent pregnancy incidence revealed a disconnection. Beyond the numbers, we face systematic and cultural challenges. Our service delivery systems, though existing, were fragmented. Our health workers lack the necessary training in adolescent-friendly care. Many adolescents feel embarrassed or afraid to seek for help. Some facilities didn't offer privacy, and worse, judgment from adults kept many teens away. In addition, our data management practices for FT and AYSRH were inefficient. We did not have a system in place at that time, and data collection was difficult. Each office in the city conducted its programs, projects, and services on FT, not necessarily reflecting existing data. Overall, there was uncoordinated programming and policy response. At that time, as a young leader who had just become a mother myself, it hit me. Many young girls were navigating their reproductive health alone, misinformed and unsupported. At that tender age, these girls are supposed to be at school and enjoying their days with their friends, classmates, and families. But because of their premature pregnancy, they are instead preparing a different world, that of motherhood. Facing a battlefield without any armor, adding to the hardship, caring for the unborn child is an additional hardship, not only for the young girls, but also to her parents, her community, including the local government. I took this as a challenge. I want to create a better and safer spaces for these young girls and boys, an adolescent and youth-friendly Santiago City. As elected officials, we all have our part, and as I reflect on the African proverb, it takes a village to raise a child. we can be of help to these young girls who were once derailed and have chosen a winding path. I found the right partner in the Challenge Initiative, TCI, through the Zwillig Family Foundation. With their help, we brought together a city leadership team, not just health officers, but also education, youth development, planning offices, peacekeepers, and community leaders, with the youth at the center of it all. We collectively gathered and harmonized all our efforts, united by the Kaisaka development strategies, 4 pillars: kabuhayan, kalusugan, karunungan, at kaayusan. With the guidance of the Challenge Initiative and the Zwillig Family Foundation, we began a deeper transformation process, not just in programs, but in leadership itself. We use the RACE tool, reflection and action, to improve self-reliance and effectiveness, to reflect on and strengthen our system and identify the root and systematic causes of adolescent pregnancy, to instill ownership and accelerate our actions to empower our adolescents and youth. We introduce to the bridging leadership approach through the Leadership for Adolescent and Youth-Friendly Cities, or the LAFC, and the Health Leadership Management Program, or the HLMP. We moved beyond simply serving the youth, and instead, we invited them to lead with us. They became active contributors to the development process, ensuring that young people had a seat at the table and voice in every decision. One policy this partnership institutionalized was the Information Service Delivery Network, as approved in Ordinance Number 11-PHCC-089 in July 2023, which ensured sustained, coordinated, and youth-friendly delivery, health, and development services across Santiago City. In schools and communities, youth volunteerism flourished. We trained 638 Santiago City teen facilitators, young leaders who now guide their peers on navigating AYSRH issues with confidence and empathy. In collaboration with teachers, health workers, and SK leaders, we launched 59 teen centers, each on a safe, youth-managed, safe space for learning, support, and empowerment. This empowered adolescents now champion behavior change through Youth for You, a social behavior change communication strategy to inspire, inform choice, and shape a culture where young people are protected, heard, and uplifted. As a result of our action in harmonizing our initiatives, prioritizing and investing in our adolescents and youth populations, and adopting high-impact practices on adolescent-friendly health services, we were able to achieve the following in 3 years of partnership. We decreased the number of adolescent girls getting pregnant from 47% in 2020 to 30% ADR in 2024. Our MCPR remains strong, remaining higher than the national target, 39% in 2020 and 37% in 2024. And more importantly, contraceptive use among youth is now better informed, more consistent, and voluntary. Health-seeking behavior among youth has improved thanks to responsive health workers and the comfort of peer-led, judgment-free services. We made AYSRH and family planning services readily available, resulting with notable improvement in the quality of health and life of young girls and boys. Our partnership with the Challenge Initiative allows Santiago City to take steps towards our vision: resilient, equitable, sustainable, innovative Santiago City. We will continue to rise as we take bold approach to rapidly and sustainably scale high-impact family planning and reproductive health solutions for women. We are grateful for this partnership, and we assure you, we will continue to work with you together. Kaisahan namin kayo, Commission on Population and Development, Department of Health, the Challenge Initiative, Smilig Family Foundation, at sa lahat ng kampiyon na nakikiisa sa laban ng bawat kabataan para sa kanilang kalusugan at pag-unlad. We will continue to mentor and coach leaders and our youth to advocate for better health-seeking behavior. Maraming salamat po. Serbisyong tapat, serbisyong kamsat.
Thank you, Ms. Joanna. Santiago's focus on youth empowerment and peer education highlights the importance of engaging adolescents as partners in advancing health and development. At this juncture, I hope everyone has been informed, even inspired, by the stories of change by our three cities, starting from the rising tide of adolescent pregnancies and the pandemic. Our mayors and their city leadership teams responded through co-ownership of problems and co-creation of solutions. Mabuhay kayo, Iligan, Naga, and Santiago. Now, before we proceed, we would like to acknowledge some of our guests attending our webinar. We acknowledge the presence of Honorable Nelson Legacion, Mayor of Naga City, Dr. Glenn Manarpaak, City Health Officer of Iligan City, Mr. Rayan Cedric Rentoy, and the rest of the Naga City leadership team who are watching in their own venue, Ms. Joanna Gabriel and the Santiago City leadership team also watching us from Santiago City. We are also joined by Mr. Nathaniel Vergara, City Population Officer of San Jose City, Dr. Evelyn Rimando of the Manila Health Department, who will be presenting during our next session this Wednesday. Again, everyone, thank you po for attending. We enjoin our attendees who want to learn more or have questions. Please post your questions on the Q&A button seen at the bottom of your screen. Our online team will relay our responses to the questions, and a list of these frequently asked questions will be shared as part of our post-webinar learning kit. Now, we invite our partners from the Commission on Population and Development to share their impressions of today's presentations. First, from CPD Region 5, we have Ms. Joyce De La Paz. Ms. Joyce De La Paz Silvano is a born and bred Commission of Population and Development member, rising from the ranks from a working student in CPD NCR to internal quality audit team leader to now regional director of CPD Bicol. She also serves as co-chair of the Social Development Committee in Region 5 and the Board of Trustee of the League of Executives and Directors Bicol. An advocate for reinforcing personal core and ethical values and reduce vulnerabilities of young people, she helped establish the Heart and Minds campaign in Bicol. She has a bachelor's degree in accounting and a master's degree in public administration. She is also a reservist of the Philippine Air Force. Let us all welcome RD Joyce De La Paz Silvano.
My warmest greetings to all distinguished and honorable personalities gathered here today, to our vibrant local champions, regional line agencies, and the generous development partner, and all other national and international guests. A blessed day to all. Today we celebrate the key milestones of three remarkable cities, Iligan, Naga, and Santiago, where local executives, leaders, and their respective teams forged their courageous paths towards safeguarding the health, dignity, and future of its young people. Well, today's presentations were more than just reports. They were stories of resolve, resilience, and reinvention. For Iligan City, we saw how a city faced its trend in adolescent birth rates and responded with a systemic responsive program to its empowered city leadership team, who adopted high-impact interventions to shift the tide. The realization of success was showcased through a transformation where grounded leadership and compassion paved the way to engage all stakeholders, to design data-driven action in a policy environment that supports strengthened access to health and care healthcare and services, and relevant initiatives. Meanwhile, for Naga, long recognized for its good governance, reminded us that it is possible to infuse significant changes to improve its prevailing robust system. As an independent chartered city, Naga's progress was challenged by an alarming rise in adolescent births from 2020 to 2022, both from residents and transients. Their partnership with the Challenge Initiative paved the way to create an empowered and energized city leadership team that implemented high impact practices. Well, Naga City Mayor and incoming Congressman for the 3rd District of Kamsur, Nelson Legacion, immersed himself to see the realities firsthand. On this, he and his team placed premium on collaborating with key stakeholders, increasing health investments and competencies, upscaling community education and interventions, enhanced data collection for evidence-based decision. They also meticulously strive to create a self-reliant, holistic, and sustainable model for Julie. They have been duly accredited. They have duly accredited adolescent-friendly health facilities, city-certified adolescent-friendly barangay health stations, community teen centers, school-based teen hubs, while having established their ISDN to streamline access and necessary policies in place. Their breakthrough, reducing adolescent birth rate significantly from a staggering 110 in 2020 to just 20 in 2024. Really, they're still doing a lot to zero in on young pregnancies. Well, that is not success. It's actually a blueprint. And for Santiago cities, city nation is just a missed opportunity. So Santiago saw a mismatch. There was high contraceptive prevalence, yet even a higher adolescent birth rate. So through their partnership with the TCI, they saw clearly through a lens of the need for a transformation. Acknowledging it should start with leadership. They addressed fragmented systems, harmonized efforts, and ensured their engagement of the youth. As a result, they created safe spaces in really acknowledging 5019 centers, trained over 600 peer facilitators, and institutionalized their commitment through local legislation. It also showed a drop in adolescent birth rate from 47, a drop in adolescent birth rate in the last 3 years and decline in the For Santiago City, their youth didn't just benefit, they became co-leaders. So across all these 3 cities, several common threads emerge. One is that youth participation is non-negotiable. When we deal on improving health and building opportunities of young people, we are not just beneficiaries, but essential partners in development. Second, data-driven leadership leads to better governance. From Iligan's data mobilization to Naga's detailed tracking of adolescent pregnancies to Santiago's system harmonization, we saw that evidence, when used well, transforms policy and practice. Third, systems strengthening over quick fixes. All 3 cities invested in ensuring institutionalization through enactment of policies, placing premium on strengthening collective efforts, cross-sector collaboration, and youth engagement as they realize that progress is not just a moment, but a movement. Fourth, bridging leadership facilitates the pathway in making a positive difference. Now, leaders are able to immerse themselves and know firsthand the realities on the ground. Thus, the transformation through their journey on ownership, co-ownership, and cost-sharing is able to accelerate that attainment of collaborative response to address their societal inequities. For my recommendations, it's vital now for all 3 cities to ensure and invest in sustainability efforts. We already have institutionalized, so sustainability efforts would now be the next pathway. We need to recognize that there will be turnovers and transition of leaders and stakeholders. Also, there is a need to sustain with relevant policy, resources, and investments, as this will affect the program when priorities would shift. Moreover, continue to sustain the engagement of people. We should acknowledge that there will be plateaus in terms of engagement of people, both those serving and those being served. Periodically check on them and re-energize the fire and the drive within. We have reached this far, and you can do more by making that positive change in people's lives and in your respective cities. Engage their hearts to retain that passion. Lastly, consistently evaluate and revitalize the program. Learn the lessons along the journey, and we should be cognizant that in order to remain relevant, we should continue to evolve to be able to appropriately respond to emerging trends and evolving needs of our times. To the three cities represented today, saludo kami sa inyo. You all proved that local government is not helpless in the face of a national issue. You have all demonstrated that political will and malasakit, when coupled with community engagement, inclusive collaborative response, and the appropriate support mechanism strategies truly save lives and affirm a vibrant outlook for a progressive future. The journey does not end in today's recognition, but has signified to start the journey to evolve and elevate. Again, my sincerest congratulations.
Thank you so much, RD Joyce, for listening to all the city presentations and for all your wonderful insights and recommendations. Thank you po. Now, let us hear from CPD Region 2, Ms. Teresa Soriano. Ms. Teresa Cawilan Soriano began her government career in 1990 as Information Officer at the Commission on Population Region 2, then advancing to Regional Director of the Commission on Population and Development Region 2 in 2023. She earned a master's degree in demography from UPPI in 2004 and received multiple national and international trainings. Her excellence was recognized with awards as Most Outstanding Technical Supervisor in 2015 and Most Outstanding Assistant Regional Director in 2023. With 35 years of service, she remains committed to empowering Filipino families and promoting a people-centered development. Let us all welcome RD Teresa Soriano.
Thank you and masayang pamilya. In behalf of the Commission on Population and Development Region 2, we extend our joyful felicitations to the local government units of Iligan, Naga, and Santiago City for having been conferred the Challenge Initiative Certificate for Global Self-Reliance in Urban Reproductive Health by the TCI-Philippines Family Foundation. Today, we are grateful for this opportunity to have listened to the inspiring stories of the three cities on adolescent sexual and reproductive health and on family planning. It was indeed a painstaking but triumphant journey in championing the lives of our young people. This celebration of achieving greater strides in FP and ASRH is very timely, as the country has just chosen new set of leaders at the local level who should sustain the momentum reached in these three cities. We in CPD welcome opportunities to work in partnership with the TCI-ZFF for affording LGUs their technical expertise and providing tools and consistent support to local governments who manifested their desire and commitment to address prevailing ASRH issues in their areas of jurisdiction, particularly high adolescent birth rate and low modern contraceptive prevalence rate. Your journey for almost 5 years to becoming self-reliant cities on urban reproductive health went through several phases and processes where you were made to better understand the occurrence of said challenges, analyze underlying causes to have a better grasp of the situation, to serve as inputs for policy formulation, strengthening and putting in place needed structures and convergence mechanisms. I would say that the presence of the city leadership team served as a very strategic system of ensuring a more focused and consistent approach in dealing with the issue of high ABR, as this requires multi-sectoral interventions. Of significance too is the implementation of series of capacity development activities for the CLT members, enabling them to assist the local chief executive and city officials to design and implement responsive strategies. Onboarding the LCE was an opportunity to generate their appreciation and support to the challenge initiative. From your stories, I saw 5 critical elements that greatly help you in your journey to your desired realities, which are common to the 3 LGUs. First is the presence of updated data and information which you utilize for planning, assessment, and monitoring. Second is the importance of stakeholders' consultation and dialogue, which finally led to convergence of efforts and resources to be able to holistically address the issue of high ABR. Third critical element indicated in your stories is the need for evidence-based planning, which led to the development of your LGU program design. Fourth very vital aspect that I have seen in your sharing is consistent advocacy and policy support. And fifth one is the presence of capacity development efforts for the LGU. And the most important ingredient, which was demonstrated in your sharing, is the involvement and commitment of the local chief executive in the entire implementation of the initiative. Bridging leadership in all phases of the program is very crucial and should be given in all undertakings. As you went through all this, cross-cutting considerations of gender concerns and cultural context were evident. These are the most important lessons gained from the implementation of the Challenge Initiative. Before I end, I would like to highlight suggested ways forward for sustainability of efforts so as to ensure that your achievements are nurtured and to ensure replication in expansion cities. One is the crafting of the LGU Sustainability Plan, which will spell out actions towards localization and sustainability. Second is the need for process documentation as basis for scaling up to other expansion sites. Third is the conduct of a TCI conference or a colloquium as a forum for sharing of LGU journey to other city governments. And fourth is the recognition of TCI champions to acknowledge the efforts of city LGUs in championing ASRH. Thank you, and hoping to sustain our momentum in driving leadership in building responsive systems for family planning and ASRHs. Thank you so much.
Thank you so much, RD Tere. You and RD Joy's reflections helped highlight the broader significance of these local efforts and their potential for replication. So at this point, we now open the floor for questions and comments from our Zoom participants. If you have a question or a point of reflection, please continue to use the Q&A feature at the bottom of your screens. So far we have one question from the chat. I'm assuming this is directed to all cities, but we'll probably ask one of our cities to provide their experience and thoughts. So the question is, what are the primary causes of high teenage pregnancy rates in your city? So may we ask one of our cities, probably Miss Joanna Gabriel of Santiago City, to probably answer this question?
Kinakabahan tuloy, parang pang Miss Universe ulit yung tanong, sir. Sige po. Magandang umaga po sa mga kasama namin muli sa The Challenge Initiative Zwilig and the cities po ng Iligan at Naga. Yung datos po talagang andyan hindi nagiging significant yung pagbaba. So ito, sir, consolidated na rin po kasi kami bumababa talaga po kami sa grassroots. So isa rin po sa mga nakikita namin na suliranin is, hindi ko naman po masasabing kultura, pero yung pong nakapaikot talaga doon sa ginagalawan ng ating mga kabataan. Aside from the family, meron na kasi yung pressure po ng mga kaibigan na kinagagalawan nila At mas madalas kasama nila kasi ang mga ito 24 oras. Kung yung 24 oras na yun, sir, mostly ang kasama nila ay kaibigan nila. So kung mali at misinformed din yung mga kapwa-kabataan nila na sinasabihan o napag-sharean nila ng kanilang problema, all the more talaga na madederail. So I guess kung bakit patuloy na lumalakas, sir, ayun pa rin. Kung meron pa rin kasing mga kabataan pa rin na misinformed, especially those youths na hindi nakaka-access sa mga ganitong programa natin. So yun po, sad to say, karamihan na rin ng mga nagiging dahilan ay pagkakaroon din po ng mga nakikita nila ito sa kapwa kabataan, nami-misinform sila ng kanilang mga kapwa kabataan na kanilang kakasalamuha sa araw-araw.
Okay, thank you, Miss Joanna Gabriel. So, the main reason would most likely be the misinformation among teenagers, no? Yun po yung aking pagkakakuha sa inyong sagot. And probably it's also one of the main reasons as well to some of our other cities, no, that we're still trying to battle, no? Okay, so while we gather other notable questions from the audience, we have prepared a few questions here which could be answered by our other cities, no? The question po is this one. So if you were asked LGUs, other LGUs that also aim to champion adolescent reproductive health, what would be your critical things, no, that you are recommending that they should work on so that they would achieve an adolescent-friendly and responsive system and services at a faster rate? Yan po. Your insights po regarding that.
Well, of course, sir, first is key to achieving success in the endeavors that we have in addressing adolescent reproductive health and concern is, of course, the partnership, developing a core group of the different agencies that will work on the issues identified. And also, it is needed, as what we realize in our city, that there should be a structured and evidence framework that will bring coherence the response to the issue. And key to this is, of course, not only identifying the gaps, but also the key partners to this in addressing these issues. And also the strong support from the local leadership is very much needed, as well as the partnership with other agencies like the one we have with TCI and other agencies like the CPD, the Commission on Population Development, and the DOH Region 10. These are key elements, as well as going down to the grassroots, the partnership of the local government at the barangay and grassroots level. These are key elements in the success of our program.
Okay, thank you, Dr. Glenn. And hopefully everyone has taken notes regarding Iligan's experience and hoping that it would also be applicable to your cities. No, thank you very much po, Dr. Glenn Manarpaa. And I will go back to Mayor Nelson. I think they have already fixed their audio. Mayor Nelson, are you still there?
Sir Jan?
Hi, Mayor. Sige po, you can go ahead and answer. Or would you like me to...
Okay na ba?
Medyo okay na, Mayor.
Sir Jan?
Yes po.
Paki-ulit po yung tanong.
Okay. The question po again, Mayor, is as a leader in progressing health outcomes, what were your realizations partnering with TCI, and how did it help you navigate the issues of adolescent and unwanted pregnancies in your city?
Okay, you're asking me about my realization insofar as the program is concerned and how it can be somehow considered successful?
Yes po. And your partnership with TCI, what were your realizations?
First of all, it is important not only for the leadership team, but the TCI leadership team, but more importantly, with the local chief executive to ensure that he himself is immersed or invested in the program. This is the reason why I oblige myself to go to the area, see the actual situation on the ground, and somehow put myself in the shoes or in the place of the intended beneficiaries, trying to understand the condition and project what will happen if things are not changed. What will happen not only to the young mothers, but also to their children. So that's one. I mentioned earlier that the TCI leadership team should likewise immerse themselves, be able to know the actual conditions on the ground. These are important, and of course, the continuing coordination between and among the stakeholders and the TCI itself, which is guiding us through the program. And I suppose this kind of mindset and or realization should not apply only to this program, but also to all other programs if we really want to effect change. And the numbers would tell us that indeed, with the right approach, with the right intervention, we were able to bring down the number of adolescent birth rate and also the number of repeat pregnancies. And for me, this is the most important achievement of the program. While our original target, which is very ambitious, is zero. While we were not able to achieve that target, but the numbers would say that we made a dramatic improvement. If I am not mistaken, from 71 in 2022 for adolescent birth rate, we were able to reduce it to 20 in 2024. And for repeat pregnancies, from 62, we were able to bring it down to 38 in 2023 and 25 in 2024. In other words, more than 50% yung drop noong number. That's significant enough for us. Although, as I said earlier, the target was supposed to be zero adolescent birth rate and zero repeat pregnancies.
Okay. Okay. Thank you, Mayor. From what I've gathered from your answers, it's the main reason for your success would most likely be apart from the immersion and involvement of your city leadership team. It's also your personal immersion as well and involvement as local chief executive, which I feel should be implemented in all cities actually.
And of course, the continuing guidance of the TCI.
Okay. And we thank you for that, Mayor. Actually, your involvement in the program is and your presence is actually such a great factor for the success of our program, and we thank you for that. And thank you very much, Mayor
Thank you,
Nelson.
Sir John. Thank you.
Thank you for your answer. And now, so for the rest of the questions, you may see them in the learning kit that we will be providing at a later note. But now we come to the most anticipated moment of our program, the graduation ceremony for the three cities. We acknowledge the city mayors of Iligan, Naga, and Santiago and their respective city leadership teams for their successful completion of the Challenge Initiative program and for demonstrating leadership and innovation in building adolescent responsive health systems. They have played significant roles in the implementation and scale-up of proven high-impact practices for family planning and adolescent sexual and reproductive health. So first, we present the City Leadership Team of Naga. Naga City Leadership Team, please open your camera to be acknowledged. Let us welcome the Naga City Leadership Team led by Mayor Nelson Legacion and City Population and Nutrition Office Head Rayan Rentoy. They have been awarded as a global self-reliant city in family planning and adolescent sexual and reproductive health. This award is in recognition of the city's outstanding leadership and unwavering commitment in implementing high-impact practices and interventions, demonstrating a clear and steadfast dedication to improving the health and well-being of urban communities. We would also like to acknowledge the guidance of their regional partners. The Department of Health CHD Region 5 under Dr. Melissa Sena and the Commission on Population and Development Region 5 under RD Joyce de la Paz Silvano. Again, congratulations to Naga City. Next, we present the City Leadership Team of Santiago. Santiago City Leadership Team, please open your camera to be acknowledged. Thank you, Mayor Sheena Tan, City Health Officer Dr. Robelin Go, and City Population Office in charge, Mr. Mamerto Gabriel Jr., and the rest of the City Leadership Team. They have also been awarded as a global self-reliant city in family planning and adolescent sexual and reproductive health. This award is in recognition of the city's outstanding leadership and unwavering commitment in implementing high-impact practices and interventions, demonstrating a clear and steadfast dedication to improving the health and well-being of urban communities. We'd also like to acknowledge the guidance of their regional partners, the Department of Health CHD Cagayan Valley under Dr. Amelita Pangilinan, and the Commission on Population and Development under RD Maria Teresa Soriano. Congratulations and thank you very much for rising up to the challenge. Lastly, we present the City Leadership Team of Iligan, led by Mayor Freddy Xiao and City Health Officer Dr. Glenn Manarpaak. May we ask the City Leadership Team to open their cameras as we acknowledge the city. They have been awarded as a global self-reliant city in family planning and adolescent sexual and reproductive health. This award is in recognition of the city's outstanding leadership and unwavering commitment in implementing high-impact practices and interventions, demonstrating a clear and steadfast dedication to improving the health and well-being of urban communities. We would also like to acknowledge the guidance of their regional partners. The Department of Health Northern Mindanao CHD under Dr. Sulpicio Legaspi Jr. and the Commission on Population and Development under RD Neil Aldrin Omega. Congratulations and thank you very much for rising up to the challenge. Again, we extend our congratulations to the city mayors and their respective leadership teams. And now, to formally close our first day session, we are honored to hear from the Chief of Party of the Challenge Initiative Philippines, Dr. Anthony Faraon. Doc Tony, as everyone calls him, is the Chief of Party of the Challenge Initiative Philippines. He also holds leadership roles in several organizations, including the Philippine Society of Public Health Physicians, the National Pharmaceutical Foundation, and the Health Committee of the League of Corporate Foundations. His previous roles include leading the Palawan Access to Medicines Project, consulting for the Ateneo School of Government, and teaching at New Era University. Dr. Faraon holds a medical degree from the University of Santo Tomas, a master's in public health from Dr. Fedel Mundo Medical Center, a master's in public management from Ateneo de Manila University, and has completed the Management Development Program at the Asian Institute of Management. Doc Tony, the virtual floor is yours.
Thank you, John. Ladies and gentlemen, colleagues and friends, what a dynamic day of learning and inspiration. To our three trailblazing mayors and city leadership teams, our esteemed reactors from the Commission on Population and Development, and partners from the Department of Health, our collaborators and implementing partners from the Challenge Initiative Gates Institute, and every leader, advocate, and change maker here today. Maraming salamat po. Ngayong araw, pinatunayan natin ang tunay na pagbabago ay nagsisimula sa liderato na handang magpakilos, hindi lang magsalita. So as we close day one, I'm reminded of a saying, the best way to predict the future is to create it. And after today's discussions, I can confidently say our cities aren't just predicting change, they're creating it. One policy, one partnership, and one empowered young person at a time. Let's quickly revisit the journey we witnessed today. Each city didn't just share successes, they gave us a blueprint for action. First is Iligan City. Mayor Freddy Xiao's hands-on governance. Mayor Xiao showed us that leadership isn't about delegating, it's about doing. When a mayor personally champions family planning and adolescent health, budgets follow, staff step up, and communities take notice. Reaching 30-31% in modern contraceptive use isn't luck. It's the result of mayors who treat health as their daily priority and not just a line item. Second is Naga City. Mayor Nelson Legacion's Barangay Revolution. Naga's success in reducing teen pregnancies isn't magic. It's mobilization. By equipping barangays with data, trust, and a mandate to act, they turned local leaders into ASRH and FP champions. So what's their secret? Mayor Legacion didn't just talk about multi-sectoral collaboration, he institutionalized it. That's how you turn projects into culture. Third is Santiago City. Mayor Sheena Tan's youth-led transformation. Mayor Tan taught us a critical lesson. Adolescents aren't problems to solve, they're partners to engage. By investing in peer educators and youth councils, Santiago flipped the script. When young people design solutions, programs don't just reach beneficiaries, they resonate with others or with your owners of change. So beyond these remarkable stories, three transformative themes emerged, each a call to action for all of us. Number one, political will equals political wins. When mayors lead with conviction, they don't just approve programs, they accelerate them. But let's be clear, political will isn't a one-time speech. It's mayors chairing RH councils, embedding family planning in city development plans, and as we saw today, holding barangays accountable. That's how you turn priority into progress. Number two, systems change starts with silos breaking. The best programs don't live in health offices alone. Naga's teen pregnancy fight involved educators, social workers, and even the Sangguniang Kabataan. Iligan's family planning surge linked health workers to livelihood programs. This is the golden thread. When sectors converge, impact multiplies. Let's stop working in parallel and start working in purpose. Number three, sustainability hinges on community ownership. A program's lifespan isn't measured by grant cycles, it's measured by how deeply communities claim it. Santiago's peer educators, Naga's barangay scorecards, Iligan's public-private partnerships. These aren't activities, they're ecosystems of accountability. Because when citizens demand services, sustainability stops being a goal and starts being a given. So saan ho tayo patutungo ngayon? There are two challenges for us. Una, ask how we can do more together. Let's move beyond best practices to next practices. Let's ask the questions. How can cities replicate Iligan's family planning dashboard and other programs? Adapt Naga's barangay engagement, and scale Santiago's youth innovation. Second challenge, commit to one action before leaving. So bago ho tayo mag-log off ngayong hapon, tanungin ho natin ang ating mga sarili. What's one thing I'll do differently because of what I learned this morning? Magre-revisit ng polisiya, makikipag-partner sa ibang mga programa at ibang mga institusyon. At dapat po nating tandaan, ang pagbabago ay nagsisimula sa atin. So bago ho natin tapusin ang araw na ito, isang mahalagang aral ang nais naming iiwan sa inyo. Ang mga alkalde at ang ating mga city leadership teams na narinig natin ngayon, hindi sila nag-intay ng perpektong kondisyon bago kumilos. Sa halip, sila mismo, kasama ang kanilang mga iba pang mga department heads, ang lumikha ng paraan patungo sa perpektong kondisyon. Ganito rin ho ang hamon sa atin. Bukas, higit pa tayong magpakamatapang, magtulungan, at gumawa ng mga bagay na talagang hindi malilimutan. So maraming salamat po sa inyong lahat. Rest well, recharge, and let's return on Wednesday for day 2, ready to build not just momentum, but movement. Magandang hapon po sa kanilang lahat.
Thank you very much, Dr. Tony, for your insightful remarks and for closing the first day of our 3-day webinar series. Your reflections affirm the vital role of grounded local leadership in sustaining public health progress and reminded us that meaningful systems change begins where services are closest to the people. We hope today's discussions have been both informative and inspiring.